You're listening to The Pulse on AMI Audio. I'm your host, Grant Hardy. Once a week, I'm going to speak with advocates from around the disability community about the topics that matter most. I've been totally blind since birth, and I'm really passionate about social justice and inclusion because I think it's the best hope for change in our uncertain world. If you're listening on AMI Audio, today's episode will repeat every 6 hours until tomorrow. Plus, our show is available wherever you get your podcasts. This week, leading advocates in healthcare from the Holland Bloorview Kids Rehabilitation Hospital launched a campaign on October 15th called No Piece of Cake. And within that campaign, a survey and research project took place called Turning 18 Isn't So Sweet: The Critical Gaps in Healthcare for Young Adults with Disabilities. The Holland Bloorview Kids Rehabilitation Hospital is located in Toronto, Ontario, but provides care to children from all over Canada. This report focused on the transitional period for patients with disabilities when they turn 18 and officially age out of the pediatric healthcare system. Dilshad Kassam-Lallani is a nurse practitioner at the Holland Bloorview Hospital who has cared for some of the province's most medically complex patients. I'm happy to welcome Dilshad to the show. Thank you so much for joining me today. What drew you to Holland Bloorview and what inspires your work?
Well, a couple of things. Essentially, my interest in disability, transition from pediatric to adult care system. I studied it in my graduate program way back 94. And also, my interest and zest for closing the gap in the healthcare system.
So, you've had a really important role in a new report from Holland Bloorview. Can you talk a little bit about your role in that report and tell us what you found?
Sure. Well, the Holland Bloorview um, has known for a while that transition from pediatric to adult care system is a difficult one.
Mhm.
And it recently convened a group of experts, uh, clients with disability, as well as their families, to learn more about the issue and also inform a survey that they developed, and it was then it was then distributed by an external company, Leisure,
Mhm.
to understand better the scope of the issue of transitioning from um, pediatric to adult care for those with disability. And so I was on the panel to inform the survey as an expert.
So it's a really interesting report, and we'll mention how people can read that for themselves. But I wanted to just introduce a couple of the key issues and findings. One was that care becomes more fragmented and siloed. Can you tell us how that impacts marginalized people?
Yes, definitely. When young people with disability cross over to the adult care center, it is a fragmented system, and whereby they are used to a one-stop shop system in the pediatric care. However, with adolescent who find it difficult to navigate the system in the adult world, they often will disengage.
Mhm.
And so then, there is a risk for becoming um, more sick or missing appointments, ending up with more emergency visits and admissions. And in one case, we had a client who relied on home care to have their catheter changed, and a decade later presented at the adult ER with urosepsis, essentially a life threatening condition requiring ICU admission. And that could have been prevented
Mhm.
completely if the system was not so fragmented and difficult to navigate.
Yeah, and it's just tough as a lay person, and especially from a marginalized community, to have to sort of navigate the system as well as just receive care.
Yeah.
Um, one of the other barriers that I thought was really interesting had to do with attitudinal barriers, and this particularly impacts people with invisible disabilities. Can you talk a little bit about that?
Yeah, there's like, I think about almost 50%, 49% experienced attitudinal barriers where they felt that they weren't listened to, or they felt they were made to feel inferior to the clinicians or the adult care providers are some examples. And that becomes an issue because then, these young adults will have a difficult time advocating for themselves and engaging in the adult care system to keep well. And they need the surveillance um, across their lifespan.
Let's talk about demographics and based on location, other demographic data like that. How does that impact your access to care?
Well, depending on where you live, the level of education, essentially the determinants of health will impact access to healthcare, to health information, um, and overall engagement in the adult care system.
Um, what other access issues impact one's ability just to show up and access care and access appointments?
Well, for example, transportation, there's a financial cost to that and effort depending on where you live. You may be living really far away. Um, and also accessibility. There are, washrooms that need to be accessible as opposed to inaccessible. And we hear that many adult care centers don't have accessible exams even.
Mhm. And what do you mean by accessible
Sorry,
exams?
exam tables is what I meant. And so their assessment is limited.
Mhm. Interesting. And what are some of the other issues that were highlighted in this report? Particularly, I don't know if there's something that was most
Yeah.
surprising or most meaningful to you.
Well, you know what? Honestly, there wasn't a whole lot that was surprising to me.
Mhm.
I've been studying transitions, medical transitions for a very long time. And while we've made some strides, unfortunately, transition care programs in hospitals, both especially, pediatric included, are not consistent, right? And so therefore not equitable. Right. So they weren't surprising to me. And some of the key issues that were found in the report is that, there's a shortfall in adult services, for example. So 50% of young people are still actually seeing their pediatric provider because they can't find access to the care that they need in the adult care system. And then we have the issue of access to primary care. And more than one third of young adults with disabilities wait up to 3 years. I have a patient who waited 3 years, and in the interim, I provided care. And some of them still don't have primary care provider who's so important in leading the care and coordinating their care. These young people have very complex medical conditions that require um, navigation, multiple services. And when you don't have that one stop shop, as I mentioned earlier, it
Mhm.
becomes so difficult for them to access care. And the other thing is like the financial implications, right? So, approximately about 80% have faced an increased um, medical cost since transitioning to the adult care system. And I think about one third reported that their costs increased by $6,000, which is phenomenal. And that's per year. And then, of course, we talked about the attitudinal barriers, where 50% of them had experienced attitudinal barriers when accessing healthcare, feeling judged, ignored, or inferior, and sometimes also not being able to access care.
Mhm. So we've talked about long waits. We've talked about a patient that literally, received an infection or additional complications that they didn't have to receive if the system was set up differently. So as you think about, some of the patients that are about to age out of care, what would you say the most crucial risks are that they face?
Well, you know, in Canada, the literature shows that there are about 70,000 medical transitions that occur every year, which, is a significant challenge to the healthcare system in impairing really the delivery of quality of care, resulting in increased emergency visits, as I mentioned earlier, hospitalizations, missed appointments, deterioration or relapses in their condition, and also mortality like death.
Yeah, exactly. And just not being able to, you know, carry on effectively with your life and hopes and dreams because you have
Yes,
do,
absolutely. And
yeah,
health is a resource. And when they can't feel healthy and they don't have access to care, they cannot engage in the community as well as they did when they were in the pediatric system because of the support that they received, right?
that's it.
And so it's such a major letdown once they cross over, is what I call it, into the adult care system.
So I guess this is the big question. What can we do? Like, what can the public do? What can disabled people
Well,
do? What can the government do?
yeah, thank you for that question. I think that the public can go to our website, www.piece of cake is the title of our campaign, and learn more about the issue so that the public can also advocate. And as far as, what can people with disability do is advocate, right? Advocate for early planning to transitioning, so you are ready by the time you're 18, and also advocate for better care in the adult care system, so that you're understood, and the providers understand um, concerns and know how to address based on developmental level, based on disability. And so, there's lots that can be done. Sorry. And in terms of the government, well, these types of programs, I'm very, very privileged to be in a program whereby transition care is embedded in the care that I provide, and that is embedded in the medical care that I provide. And that starts at age 14, in keeping with the literature. And by the time they're 18, we hope that they'll be transition ready, right? And we use
Mhm.
evidence based tools. So these types of programs, they cost and they require resources. And we've never really had funding directed towards transition care programs. And frankly, I think that transition from pediatric to adult care system, or medical transition, if you will, is now a determinant of health. It really is no different than housing or education level, because it actually causes increase in morbidity and mortality, right? And
100%.
so, yeah,
and just takes your focus and your energy too. Exactly like if you have to try and find a home, having to focus on how to access your health care really drains your energy quickly. So
It
advocating for our
does.
Mhm. Advocating for our needs is definitely the best thing to do, but I really appreciate what you guys are doing to advocate for us as well. Thank you so much, Dilshad, for coming on the show and chatting with us today.
Oh, thanks for having me.
That was Dilshad Kassam-Lallani. She is a nurse practitioner at Holland Bloorview Hospital. You're listening to The Pulse on AMI Audio and YouTube. I'm your host, Grant Hardy. My next guest is Wesley Magee-Saxton. Wesley was a patient at Holland Bloorview Hospital from when they were 18 months and aged out at age 18. Wesley has cerebral palsy and is here to share some of their lived experiences transitioning out of the pediatric healthcare system. Well, Wesley, thanks so much for joining me today. And tell me what your role is in this campaign and why it's important to you.
Thank you so much. My role in this campaign was to be a spokesperson for the launch. I was involved heavily in the launch and promotion of this campaign. As for why it's important to me, I was a former client of Holland Bloorview from 18 months old to 18 years. I'm 24, almost 25 now, and I went through the experience of aging out of the pediatric system with the support of Holland Bloorview. And I want to be able to make sure that other folks, if there is any one of the 70,000 individuals with chronic illnesses or disabilities aging out every year, I want to make sure that I'm able to help support those people who are making the transition I did.
So tell me, what was that transition like for you?
I've described it as akin to dropping off a cliff, or you go over a waterfall and you suddenly find out that there's no air in the raft you're in. It was very, very scary, and I cannot communicate how challenging it was. Luckily, I had a lot of support from transition programs out of Holland Bloorview, because the whole transition process ends up with you, simply because you turn 18, being unable to access care teams that you've developed relationships with for your whole life, and having to navigate an entirely different, much less centralized system is very challenging when you can't rely on people that you've come to know and trust.
Absolutely. And what are some ways that you feel like maybe you could have been better supported, either now that you're in the adult care system or just during that transition process?
Well, firstly, to answer that question, I want to highlight that Holland Bloorview is really a leader in that field, and I'm happy to see other places following their example, because I was incredibly supported by Holland Bloorview, even from as early as 12 or 13, to get on waiting lists and be more aware of, things we had to be for the transition. And then as I approached that quote graduation unquote from Holland Bloorview, we were very focused on trying to get me established and trying to ensure a smooth transition for services and all that. In terms of where I could be more supported, we've established at Holland Bloorview, we've established what's working, and I would love to see more of it being done. And then in terms of the adult care system, I would love to see, again, just more of that same work, more of that bridge work, so it's less falling off a cliff and more, of going over that bridge and being met by wonderful people on the other side.
And absolutely, for someone in that position, being really at a leading organization and having all of that support, that's got to be maybe much more difficult for someone elsewhere in the country who may not have access to that same support. What would you say was the most shocking impact that aging out of the healthcare system caused?
For me, the most shocking aspect was that my experience with Holland Bloorview was incredibly centralized. Most of my services that I needed to access for whatever needs that I had were mostly under one roof at Holland Bloorview. And if they were not, Holland Bloorview acted as a central hub that I could come back to and figure out where to go for the services that I needed. I'm finding that the adult healthcare system is wonderful. It's amazing when you're able to find places, but it's far more siloed and less centralized. So there's not so much of that central hub to come back to. And I know that was incredibly shocking in terms of that transition.
Absolutely. And along those lines, I wondered if you could comment on something that I've experienced as a fellow person with a disability, which is sometimes adult care can not only just be inaccessible, it can just simply be undignified. Have you had those types of experiences, or what would you like to see change kind of along those lines?
Well, thank you so much for asking that question, because I think this is a question that needs to be discussed more, both within the disability community and outside of it. I want to start off by saying that I've had, as you said, undignified experiences on both sides of the pediatric care system and adult care system. So it's not necessarily relegated to one or the other. But I would love to see a greater emphasis, as Holland Bloorview and their adult partners have really been championing, but they can always do more of it, of a more collaborative approach with clients as opposed to a more directive one. So there is space for, more perspectives in the room. The client is the expert of their own lived experience. Holland Bloorview and their adult partners bring the clinical expertise needed, and it's sort of working together more as a team as opposed to being directed to do things. And I know people are on the right path with that. Things are changing, and I've seen it. It's wonderful. I just want to see more of it.
Exactly, more of it. And I think that's where this campaign and the accompanying survey, the research is really going to help hopefully push, our country to move into sort of a new era of healthcare, or the province of Ontario at least. Why do you think young adults deserve better when it comes to aging out of the pediatric healthcare system?
I think young adults deserve better in terms of aging out, because our healthcare needs don't change just because we had one number on our age change. And it's incredibly challenging to make this transition to the adult healthcare system that is far more siloed, and it's more difficult for, the sum of its parts to communicate, because that causes a delay in necessary healthcare aspects and necessary support. And then that further puts strain on an already very strained healthcare system. So I really think young adults and everybody, the system, young adults, everyone involved deserves better, because the reality is our situations don't often change just because of one day before or after my birthday.
Yeah, no, it's a really good point, and thank you for sharing.
Thank you.
You've mentioned just how much Holland Bloorview means to you, but I wondered if you could elaborate a little bit more on that, and also just whether you still, keep in contact. I mean, I'm sure you do, but to what extent do you still rely or keep in contact with your some members of your care team from your youth?
Well, let me break that down for you first. So in terms of, what Holland Bloorview means to me, I mentioned that I was a client from 18 months to 18 years, and then I started working for Holland Bloorview in 2019, transitioned to another job at Holland Bloorview in 2020 that I've stuck with until this point. It's one of the 4 jobs that I currently work, both inside and outside of the hospital. So I have, I've been stuck around Holland Bloorview for a very long time, and I don't see myself as leaving anytime soon. It was and still is in some ways a second home for me. It was revolutionary in terms of making sure I had a wonderful quality of life throughout. my childhood and my adolescence and really understood what was happening with my body, mental health, etc. In terms of answering your question regarding do I still keep in contact with some of my previous care team, in a care aspect, no, that is not allowed for what might be obvious reasons. In terms of the fact that I'm now an employee at Holland Bloorview, I have had the very odd experience of now working concurrently alongside people that used to be part of my care team. So in terms of keeping in contact with them, I now work with some of them, but I don't access them in terms of a care team anymore.
I don't mean to put you on the spot here, but can you talk a little bit about your work at Holland Bloorview?
Of course. My position at Holland Bloorview is a member of the solution-focused healthcare coaching team, and I work as a junior educator on the team, helping teach clinicians and other staff members, both within Holland Bloorview and through other workshops that we offer about the practice of solution-focused healthcare coaching. So that could be giving workshops to Holland Bloorview staff or helping to co-facilitate workshops that Holland Bloorview offers to other locations.
Thank you for sharing it, both about your work and just what the hospital means to you in terms of kind of that family or community. So I wanted to end on this. One of the reasons to make healthcare easier, more accessible is, just so we can move on with life and not have to worry about it so much. So I wanted to ask you what your dreams are.
Oh, that is a big question. In terms of healthcare or outside of healthcare per se?
Just for your life.
Well, one of my main, I could definitely speak about career-wise. I went through York University's acting conservatory program, and I work as an actor here in Toronto. The big dream for me would, of course, be to make it to Hollywood. That would be wonderful. And to gain the means to be able to, advocate for the disability community and other marginalized groups, and to be able to gain the influence to do that. That's certainly a big dream. But also just making sure that once I have my needs met, I can help others meet their needs, regardless of what that looks like. Being comfortable enough to be able to in turn support other people.
Thank you so much for doing all the work that you are doing to help the disability community. And thank you so much for coming on the show.
Thank you.
I'd like to thank Wesley, Dilshad, and Aaron from Holland Bloorview Hospital for taking their time and arranging these interviews with me today. Really important work and advocacy that they're doing. The Holland Bloorview Kids Rehabilitation Hospital wants you to help them raise awareness. You can visit www.hollandbloorview.ca to read their full report and help them raise awareness for the need for systematic reform in the healthcare system. AMI Today and The Pulse will repeat every 6 hours on AMI Audio and is also available to watch again as soon as the show is over on YouTube. Plus, you can find The Pulse and AMI Today wherever you get your podcasts. I'm your host, Grant Hardy. Thank you for listening.